You know, there were a lot of, in the recent past, we've seen many fit and young persons falling prey to cardiac arrest, to heart attacks. Of course, they are two different things, but to what is called ailments of the heart. There were lots of studies saying, oh, it must be because of the VAX that you took, the vaccination. Post-COVID, when all of us took vaccinations, we also took booster shots. That has been debunked. It's a very important story for those who keep believing that if I'm having hair fall, it's because of VAX. If I can't hear properly, it's because of VAX. That is not the VAX, but as in VAX. But now AIIMS, no COVID VAX linked to young adult deaths. Let's see what the story is. A comprehensive study by the All India Institute of Medical Sciences has found no scientific link between COVID-19 vaccination and sudden deaths among young adults, firmly countering claims that blame COVID vaccines for a spate of cardiac arrest in the young. Now, the one-year autopsy-based observation study was conducted at AIIMS New Delhi between May 23 and April 24 and analyzed 2,214 autopsy cases received at the forensic mortuary. Out of this, 180 cases met the criteria of sudden deaths. Importantly, young adults aged between 18 to 45 accounted for 103 cases or 57.2%, while those aged 45 to 65 made up 77 cases or 42.8%. The study found that the incidence of sudden deaths amongst young people was 4.7% of all autopsied cases, with the average age just 36.6 years and a male to female ratio of 4.5 to 1. Crucially, researchers also discovered that COVID infection history and vaccination status were comparable across age groups with no causal association between vaccination and sudden deaths. Instead, the study points to underlying coronary artery disease as the leading cause of sudden death, followed by respiratory causes such as pneumonia and tuberculosis, and a small number of unexplained cases requiring further investigation. The study reinforces global scientific evidence on COVID vaccine safety, even as doctors warn that misinformation on linking vaccines to sudden deaths can undermine public confidence. Let's ask experts in health for more clarity on this study. We have Dr. Rakesh Yadav, Professor, Cardiology, AIIMS New Delhi, and Dr. Sanjeev Gera, Director and Head, Interventional Cardiology, Fortis Hospital. A very, very warm welcome to both of you, doctors. Great for you to have joined us and made the time from your busy schedule. Dr. Yadav, let me come to you first, Dr. Yadav. I mean, congratulations on this study by AIIMS, and who else but AIIMS can do these studies which will go down in the annals of history as making a very important contribution. This is a very important study because we saw a lot of young people, some of them very well known, you know, actors also, fit, no smoking, no history of alcohol, working out day in, day out, but then suddenly they fall, they say it's a cardiac arrest, and there it is. Recent study also by Chennai, you know, there was a study, they said that the heart arteries, you know, the inflammation is also because of a post-COVID syndrome. But your study has completely debunked it. Rakesh Yadav, over to you, Doc.
Yeah, this study, which was done in approximately 2,000 autopsy patients, in which about 180 were sudden cardiac death. And they compare with the vaccine status, with the occurrence of COVID in the past, and they found no correlation. We always believe that this is a hype that COVID vaccine is leading to sudden cardiac death. The biggest thing is we have a very high incidence of coronary artery disease even in younger ages. And what is the prevalence of coronary artery disease? We all know about 9 to 10% prevalence in this country. So the coronary artery disease comprises the majority of the cases. So don't blame COVID vaccine.
Yeah, right.
It is your coronary artery disease which is responsible.
You know, you say don't blame the COVID vaccine. You know, first of all, yes. Dr. Yadav, what made you to do this study? I mean, much like me.
There was a lot of
everywhere. Everything they were saying, it's because of the vaccine that I'm getting hair fall, my skin is breaking out, my digestion is very bad. Look at it. My friend died, he was 35 years old, playing badminton, he collapsed. There was a lot of misinformation, Dr. Yadav. Is that what propelled AIIMS to conduct this study, sir?
Yes, yes. This study was basically conducted by Indian Council of Medical Research, and AIIMS is the part of that study. The autopsy were done in the AIIMS forensic department, and I think Dr. Sudhir Gupta was leading this investigation. And they have done a very good autopsy. It's a molecular autopsy. They have done a DNA analysis to find that if there is any correlation with past vaccine or past COVID disease. So they don't find any evidence in the heart that this sudden cardiac death is because of COVID vaccine. Though I can say that there is a lot of observational study in the Western country in which RNA vaccine was used. So they claim that there is slight increase in sudden cardiac death, but in our study, it was not being reported. It's a good, and we all believe it. The vaccine cannot lead to increased incidence of sudden cardiac death.
Yeah.
Yes, it is being observed that during COVID and post-COVID, this is known as post-COVID syndrome, there is a high chances of thrombosis, which can lead to high chances of stroke, but it is not. Vice versa, you have saved so many people by giving vaccine.
Right.
So this was just a public myth, which is being clearly clarified by a scientific evidence.
All right.
We used to say no. Now it is a scientific evidence that it is not related with COVID vaccine.
All right. Dr. Gera, let me bring you in, sir, here. You know, like I was referring to the Chennai study, it says acute coronary syndrome or ACS, a sudden blockage in the heart's blood flow that can lead to a heart attack, is rising sharply amongst the young as 18. One of the reasons is post-COVID. Now, if I read this report as a, lay person, and then I read AIIMS report, the thing is that this misinformation should somewhere stop, Dr. Gera. Like what Dr. Yadav said very well, thrombosis, yes, during COVID. We can understand, but the point is, now can we take it as final that the COVID vaccination has nothing to do with the rise in, heart attacks or cardiac problems amongst the young? Dr. Gera.
Yeah. So that is very correct. Actually, earlier there was a study from ICMR also 2 years back, and now this AIIMS study, post basically autopsy studies. So it is very clear that vaccination or COVID itself is not directly linked to sudden cardiac deaths in young population, especially. What Chennai study told us that there is high incidence of acute coronary syndrome among young who die of sudden cardiac death. But basically, the theory or hypothesis which can be made out is that the people already, because of bad lifestyle, they already have some plaque, some block already lying in the coronaries because of our lifestyle, maybe because of pollution, maybe because of so much of processed food intake, lack of inactivity, which actually COVID led to. COVID led to what? COVID led to work from home. So we became more static. And it led to actually working from home at night. People were not sleeping well, hormonal disbalance that caused more inflammation. So you cannot link only COVID or COVID vaccine to mortality or certain cardiac deaths. It is our lifestyle. So we were already having that plaque that gets ruptured because of acute stress, shear stress on the artery, because of high blood pressure, high sugar, high pollution, cold environment, smog. So many reasons are there for Indians to have such acute coronary syndromes. So that is the reason. It is not the vaccine or the disease itself which is actually causally related to that.
I do agree this. When we look back at epidemics, Dr. Rakesh Yadav, whether it is tuberculosis, at one time it was called consumption. It was seen to be very, very contagious, and people would go to Switzerland or to the colder climes to, get cured. I mean, we have many cases I've read about it. The point of the matter is epidemics also evolve. As you experiment, you realize that, it wasn't that, it is this, etc., etc. But Dr. Rakesh Yadav, I mean, we've been reading, maybe it's getting reported more. Why is it there was a spate of, now you're a doc, right? I come to you, I don't smoke, I don't drink, suppose I'm not, but I'm suppose 35 years old. I work out, I have got one healthy child, I go to work, I take public transport, but I have a heart disease. Now, a lot of cases happened. I remember an actor from Karnataka, one of my favorites. He fell prey to this. And there were lots of other cases that so-and-so is giving a speech, boom, he falls. There are many other cases, and these were all young chaps, between 18 and 40. Then how do you explain the sudden spate, sir? Dr. Yadav, ये तो रातों रात तो हुआ नहीं होगा, कुछ तो है इसका कारण. Now when you ask doctors, they'll say, oh, there is a genetic presupposition. You know, common man doesn't understand these things, Dr. Yadav. Would you like to explain it, sir?
Yes, I can give you an example. If you drive at the speed of 40, you can meet the accident. But if you drive at a speed of 100, there's more chances. It is just a matter of statistical analysis. You will have coronary artery disease or you will not have a coronary artery disease. It is just a genetic. If you have a coronary artery disease and if your lifestyle is bad, you are smoking, your diabetes is uncontrolled, your hypertension is uncontrolled, you have more chances of getting heart attack. And believe me, if I have a tendency of coronary, my family has a strong family history of a coronary artery disease. And from very beginning, if I have a very bad lifestyle, I will have a heart attack at the age of 40. If I have a very good lifestyle, I will have a heart attack at the age of 80. So this is all statistic. I always say that the coronary artery disease in a younger population was occurring previously also, but it is not so much reported, no media hype. So it is not sudden surge. That is a wrong thing. Yes, there's a slight increase because of an unhealthy lifestyle. And the most important thing, what we are believing it, ignorance. You have a disease, you have a diabetic, you have a hypertension, still you ignore, you don't want to control it. You say, nahi, kuch nahi hoga. It is a preventable. That is the most important thing, the message I want to give. If you have a tendency, a lot of people are coming to us, they have done a routine CT angiogram, there is 20-30% plaque in the coronary arteries, and they get panic. Doctor Sahab, main to mar jaunga. I am going to die, I will have a heart attack. I say, no, you belong to a low risk category until you want to disturb that plaque. You want to make that plaque unhealthy. That is on your hand. So if your LDL cholesterol is very high, take statin. If you don't smoke, your obesity should be decreased. So these all factors in multiplication decreases the chance of coronary artery disease and acute heart attack. That is a concept which needs to be given.
Right.
Don't worry, if I don't smoke, I have all the healthy lifestyle, still I have a genetic makeup. So I will have a heart attack.
Right.
But if you take all precaution, the heart attack will occur approximately age of 70, but if you don't, it will occur in younger age. This is all which I want to give a message that don't panic. If you have a coronary artery disease, you have a strong family history, just change your lifestyle. The chance of having heart attack in up to age 50 or 60 will be very less than 0.5%. So 0.5% is a less chance.
Yeah. Dr. Gera, so can we take away, and it's very good news, that COVID VAX has nothing to do with sudden spurt of heart attacks, Dr. Gera? I mean, it's a very important message, because not just heart attacks, like I started this conversation by saying, several other things are now being attributed, and a lot of people have not had vaccination. Let me tell you, I'm informing you, someone in my family, he said that the minute I have it, I'll die. I've seen this, you know, because remember that when I was a child, I do not know, you know, we had this these VAX, and then, you know, some children would really have fever for 1 week, some children would have swelling, they would have pus in it. Things have improved. My kids didn't have any of that. But Dr. Sanjeev Gera, don't you think it's absurd to kind of just keep blaming the COVID VAX for every little ailment that one gets?
Yeah, so basically the people, they can suffer all vaccine related side effects like some fever or some reaction at the injection site, but you can't actually correlate every side effect with vaccine. So it is actually just a myth or hype, you can say, but I don't think that vaccine is directly related to anything else. But the only thing people used to have, you know, after COVID vaccination, some injection site pain, some 2 to 3 days fever, some coryza like nasal, you know, some rhinorrhea type of thing, sneezing. But I don't think any serious side effect were encountered after COVID vaccination, whether it was mRNA or non-mRNA based vaccines.
No, thank you both, Dr. Yadav and Dr. Sanjeev Gera, for joining us on this broadcast, and thank you for exploding the myth. Just because you had a COVID vaccination, you're not going to get a heart ailment. People who are dead, sorry for their loss, really sorry. But please do not attribute the COVID vaccination to their sudden deaths. There were several other reasons for it.